Okay. Woo. This isn't, I don't know. Okay. Good morning, or excuse me, goodness gracious. Hey everybody. My name is Dion Treywick, and I'm here from Facts Over Fear, what you should know about COVID-19 at the height of flu season. So I'm going to try to look at this camera and see if I can look directly at you, which just seems to be a problem right now. But as the world continues to battle the coronavirus, it's also fighting a different sort of epidemic, the epidemic of misinformation. This is what we call infodemic, and it's just as harmful as COVID-19 itself, which is leading people to downplay the severity of the disease and ignore the public health advice in favor of unproven treatments and cures. You know what? We get it. We're all being exposed to huge amounts of COVID-19 information on a daily basis. And you know what? Not all of it's reliable. Chances are that you've heard various theories about COVID-19 on social media or from friends or from family or just anybody. And with the news about increasing numbers of COVID-19 affecting people, we are tempted to believe these questionable claims. So guess what? Today, we're here to set the record straight and with actual medical experts. Again, my name is Dion Treywick, and welcome to Facts Over Fear, what you should know about COVID-19 at the height of flu season. This webinar is actually brought to you by the same team that brought you the dynamic and informative Connect and Elect series. And instead of politics, well, maybe we'll do just a little bit of politics. This time, we're going to talk about health and fitness. And this is going to be brought to you by our health and fitness committees and our sororities that are shining the spotlight on the health in our community. The Coral Springs chapter and the Pompano chapter of Alpha Kappa Alpha Sorority Incorporated and the North Broward alumni chapter of Delta Sigma Theta Sorority Incorporated are dedicated into implementing programs of service that enhance the social, economic, and educational well-being of the local and national and international communities. And guess what? Today, we have a special sorority that's joining us. We are being joined by the ladies of the Burgundy and the Gray, the first Latina sorority, Lambda Theta Alpha sorority. So give them a warm welcome, everybody. All right, so we've got 4 panelists here today, medical experts, okay? Now, our first panelist is Dr. Linda Batille. And guess what? You see her bio on the screen, and she's got that beautiful smiling face looking at you right now. But Dr. Linda Batille has over 10 years in the medical field, and she serves as a nurse practitioner for Ready Responders. She's also the founding and managing partner of Prestige Healthcare, LLC. She also serves as an adjunct professor at Kaiser University. And her experience ranges from pediatrics to the geriatric population. She is a Florida A&M grad, and she went to Florida Atlantic University to get her master's in nursing and family nurse practitioner and her doctorate in nursing in the nursing practice. She is also a member of, is that Delta Sigma Theta with the red and the white? Yes, she is. So she's going to give you a little bit more about her background when she starts to speak to you, but give her a warm welcome. Dr. Linda Batille.
Hi, good
All right,
evening,
so
everyone.
next we have Dr. Tulu McKenzie. Now, she is a double board certified pediatrician and preventative medicine physician and a Centers of Disease Control and Prevention trained medical epidemiologist. That's a lot. I just put out a lot of information for you. She is truly, truly impressive. Right now, she served, not that Dr. Batille isn't. Okay. Okay. She serves as the corporate director of the provider for informatics of the Orlando Health and is on the faculty of the pediatric residential program for the Orlando Health Arnold Palmer Hospital. Whew. Okay. She is you see her bio, she's got a lot of stuff there, but she is a graduate of the CDC Epidemic Intelligence Service, the EIS program, which provides a 2-year training program in applied epidemiology. As an EIS officer, she worked with the National Centers for Immunization and Respiratory Diseases, and she was on the Zika response, serving as the lead author for the CDC's guidance for congenital Zika virus infection. I told you we had experts, didn't I? Yes, I did. Also, one thing is that she is a proud member of the Alpha Kappa Alpha Sorority Incorporated. So let's give Dr. Tulu McKenzie a big welcome. Okay, next, we're going to go to Dr. Sandra. She's Dr. Sandra Powell. Okay. So Sandra Powell is a regional laboratory manager at the Broward Health Medical Center. She has an extensive background in laboratory science that includes both clinical and anatomical pathology medicine. That's a lot. I'm just here to tell you. These are some impressive women. She is a graduate of the University of Southern Mississippi, and she has a green belt in Lean Six Sigma from Florida Atlantic University. Okay, just a word. When I thought that it said green belt at first, I thought she was a green belt. Okay, sorry. That's just me being silly. Okay, right now she serves on the advisory board for both Kaiser and Barry University Histio Technology Program. She was featured in October 2020's issue of Legacy Magazine as one of South Florida's top Black healthcare professionals. And she was recently appointed by the governor of Florida to the Board of Clinical Laboratory Personnel and is also a 2020 recipient of Broward County's Hidden Hero for her work and contributions during the COVID-19 pandemic. I told you we had experts, didn't I tell you that? And guess what? She's a member of Delta Sigma Theta sorority. Let's give her a warm welcome. Oh, and if I mispronounce something, please jump in and correct me, okay? Thank you. Now, last but not least, guess who we have here? We have Dr. Denise Bideau. Did I say that right? Who is an epidemiologist and an assistant professor at the University of Miami School of Nursing and Health Studies. She is a principal investigator of the International COVID-19 Cannabis Health Study and co-principal investigator of the COVID-19 Cannabis and Chronic Disease Research and Graduate Education Collaborative alongside the SUNY Downstate Health Sciences University and UNC Chapel Hill. Guess this is the most exciting part. She serves as the president of Lambda Theta Alpha Foundation Incorporated, where she serves as the chair of the Lambda Theta Alpha Latin Sorority Incorporated COVID-19 task force, the ladies of the burgundy and the gray. So please give her a warm welcome. We are so happy to see you, Dr. Bideau. Okay, so let's get this party started. Right now, we're going to go to talking about COVID and influenza with Dr. Linda Batille, and this is very important. We have, just so that you know, and I'm just going to let her take over in just a few minutes, with COVID and the flu coming together, there's going to be so much misinformation out there. We want to make sure that you get the facts. So give her a warm welcome and listen very carefully to what she has to say. Thank you.
Okay. Thank you, Dion. Thank you for a great introduction. I am Dr. Linda Bataille. I currently work as a nurse practitioner with a company called Ready Responders. I'm also a founding partner of Prestige Healthcare, LLC. So tonight, my portion of the presentation is going to give a brief overview of COVID-19 as well as the influenza virus. As many of you are aware, COVID-19, I'm sorry, the influenza season started in October. So a lot of the symptoms of COVID-19 and the influenza virus does mimic each other. So just want to give a brief overview, talk about some of the similarities, some of the differences, how to protect yourself from both viruses, as well as how to properly wear your mask. So what is COVID-19? I'm sure by now we're all tired of hearing about it, but I just want to go over some of the main factors of COVID-19. As we know, it is a severe respiratory illness caused by the virus SARS. SARS stands for Severe Acute Respiratory Syndrome, Coronavirus 2. So coronavirus has been around for a really long time, but the new strand, COVID-19, emerged back in December of 2019 in Wuhan, China. So how does COVID spread? COVID-19 can be contracted through the air and less commonly through surfaces when the virus enters the mouth, the eyes, or the nose. The most common transmission method is from person to person. So what happens is if an infected person coughs, sneezes, or talks, they disperse these tiny particles into the air, and anyone that comes in direct or close contact with that individual is at risk for contracting COVID-19. This is why we stress when you are in public to at least remain 6 feet away from that individual, because this gives the virus a lower chance of transmission. So remain about 6 feet from a person around you, as well as wearing your mask. Now, less commonly, studies does show that COVID does remain on certain surfaces. It can live on a surface for about a few hours to a few days. So that's why we always say when you're out in public to wash your hands, because if you touch a surface with the virus on it and then touch your face, mouth, or nose, you can contract COVID-19. So remember, carriers of the virus can be asymptomatic as well as symptomatic. With COVID-19, it typically takes, or it can take up to 14 days for a person to exhibit symptoms. So we always say, if you have been exposed to COVID-19, we ask you to remain in isolation or quarantine for at least 14 days. Some of the symptoms include loss of taste or smell. Loss of taste or smell is the number one symptom. In our practice, if a person presents with loss of taste or smell, we rule out other factors and we diagnose them with COVID-19. Some of the other symptoms are fever and chills, cough, difficulty breathing or feeling short of breath, body aches, muscle aches, headache, congestion, sore throat, nausea, or vomiting. So now let's move on to the flu. Again, we are in the peak of the flu season, so I wanted to talk a little bit about that. Many of the symptoms of COVID-19 does mirror the symptoms of the flu or even the common cold. So it's a little difficult for healthcare providers to kind of differentiate the two. That's why testing is imperative. Again, the flu, similar to COVID-19, is a respiratory illness caused by the influenza virus. The common two that we see in practice are type A and type B, but there's also type C. Like COVID-19, the flu can lead to complications, severe illness causing hospitalizations or even fatalities. It's spread the same way. It's spread by an infected individual, expelling these droplets into the air when they cough, sneeze, or talk. And anyone that comes in direct or close contact with that individual is at chance of getting the flu. It can also be spread via surfaces similar to COVID-19. So symptoms of the flu, as you can see, these symptoms look very similar to the ones that are presented with COVID-19. Symptoms of the flu, you can feel feverish, you can have achy muscles, especially in areas of your back, your arms, your legs. You can have congestion symptoms, runny nose, stuffy nose, sore throat, cough, chills, sweats, weakness, fatigue, headaches, vomiting, and diarrhea. So although COVID-19 and the flu are both respiratory illnesses, they are caused by different viruses. COVID-19 is attributed to the new strand of the coronavirus, and the flu is caused by the influenza virus. Again, they provide similar symptoms, so testing is very imperative. So if a person does have the ability to be tested for either COVID-19 or the flu, we always recommend that they do so. The great news now, I know everyone's excited about, and I believe Sandra will cover it in her portion of the presentation, is that there's a vaccine available. There's a vaccine available for protection against both viruses. So some of the similarities, again, they're both spread from person to person through respiratory droplets. Again, stressing, please wear your mask when you're out in public and remain at least 6 feet of distance away from others. You can have fever, shortness of breath, or difficulty breathing because they're respiratory illnesses, fatigue, sore throat, runny nose, congestion, muscle body aches, headache, diarrhea, and vomiting. So there are key distinctions between COVID-19 and influenza. Um, as I stated, loss of taste or smell is the #1 sign of COVID-19. So if a person presents with loss of taste or smell, we automatically diagnose them with COVID-19. With COVID-19, it has a much longer incubation period. The incubation period, what that means is it's the time from when a person is exposed to that virus until the onset of symptoms. So with COVID-19, you can develop symptoms as early as 2 days or as late as 14 days of the infection. With the flu, people typically develop symptoms anywhere from 1 to 4 days. With COVID-19, again, because you can develop symptoms as early as 2 days, the virus can be spread for about 2 days before experiencing symptoms, and that person can remain contagious for at least 10 days after the symptoms first appear. And I believe, again, Sandra will cover this portion. That's where we go into the isolation and quarantine period. You may hear that if you're sick, you have any type of symptoms, a provider will ask you to stay home for at least 10 days. If you've been exposed, because the incubation period can be for up to 14 days, to remain home for 14 days. With the flu, most people are contagious for about 1 day before they show any symptoms. Also with the flu, most people will recover in a few days to less than 2 weeks. So I don't know if you ever had the flu before, but it takes a good 2 weeks before you get back to feeling yourself. With COVID-19, I've had patients a month later still experiencing some of the symptoms. So it's difficult for them to return back to their daily activities. COVID-19 does contribute to the super spreader event, and you've probably heard this on the news. And what that means is that if one person is in a room of 20 people, they can infect all 20 people with the virus if they're not at least 6 feet apart and they're not wearing their mask. With COVID-19, you also see more severe complications, meaning people who are more at risk, who are more vulnerable for contracting the virus, like the elderly or the immunocompromised, they're going to experience more severe complications. With the flu, now we're seeing that more children, Dr. McKenzie is going to cover the pediatric portion, but more children are becoming positive for COVID-19. But when it comes to the flu, the children, healthy children, are at higher risk for contracting the flu than COVID-19. With COVID, there's no antibiotic for it. We mainly just treat the symptoms as they appear. With the flu, if a person presents with flu symptoms and we test them and they're positive for flu, we treat them with antiviral drugs. So risk factors, as I stated in the previous slide, some of the risk factors are older adults, immunocompromised individuals, people suffering from chronic diseases, but this is not limited to, example, heart disease, diabetes, lung disease, and pregnant women. Again, the more chronic conditions you suffer from, the higher the risk of complications if you're positive for the flu or COVID-19. Another thing to remember is that with the flu, I forgot to mention it on the previous slide, but with the flu, everyone who presents with flu exhibits symptoms. With COVID-19, you may exhibit some symptoms, you may not. So with the flu, the symptoms are much more transparent. With this risk category, we tell these individuals to be especially precautious and especially cautious in taking their precautions to protect themselves, such as social distancing, wearing their masks, hand washing. And if they do test positive for the flu or COVID-19, as healthcare providers, we're more vigilant and more aggressive in treatment because we don't want them to have any type of complications leading to hospitalizations or death. So we try to do our best in preventing them from being hospitalized. So there are warning signs of illness. This list, like I said, is not limited to the things that are on this list, but these are the common things that we most likely see if a person has complications from COVID-19 or the flu. These are things that require immediate medical attention. Examples are trouble breathing, persistent pain or pressure in the chest, confusion or hypoxia. So what happens in the category of confusion or hypoxia means that there's a lack of oxygenation to the brain. So you'll notice that person becomes more confused and disoriented, and that's definitely an emergency warning sign. They also have the inability to wake or stay awake. So if you notice that person, you're trying to wake them up and they're just not waking up, usually that's a warning sign that they need to seek immediate medical attention. Bluish lips or face, which is another sign of decreased oxygenation. And I always say any other symptom that you feel is severe, unusual, or concerning to you. So you should know your body, listen to your body. If there's something that's just not right, it's always better to seek emergency medical attention and for us to go ahead and evaluate you and turn you away. There's not an issue, than to stay home and be worried. So we always say, come anyway. I always tell my patients, go to the hospital anyway, let them evaluate you and then send you home if it's not an issue. So the proper way to wear a mask. So wearing your mask properly can reduce your chance of contracting COVID-19 as well as the flu. I cannot count the number of times I've been out and people are not properly wearing your mask. If you don't properly wear your mask, you might as well not wear a mask at all. So on this diagram, you'll see that the proper way to wear your mask is to make sure that it's sealed at the nose area, covers the mouth completely, and covers underneath the chin. I see people wear their noses out. I've even seen people where the mask just covers their nose and their mouth is out. So it doesn't provide you any protection. So always make sure that the nose area is sealed, properly covering your mouth and goes underneath your chin. And that will provide you the best method of protection against COVID-19 or the influenza virus.
That was awesome, Dr. Patil.
Thank you. Thank
Okay,
you.
so we have a few questions. We do.
Okay.
Okay, so the first question is from someone that is currently fighting COVID-19 right now. And she says that she has asthma and she's actually very fearful, but she feels that maybe I should just read this question out. She says, I have asthma and I was very fearful because this is, but my PCP and a friend who is a pediatric MP both seem to feel as though COVID does nothing like asthma lungs. They report that although asthma patients suffer respiratory issues with COVID, they seem to do better than expected. What are your thoughts?
So this is every provider treats their patient in a different method. So it's kind of gray area, but she is considered a person that is high risk. She falls in the category of having a chronic condition. So usually if she's exhibiting symptoms, not just that she has asthma, but she has to actually exhibit symptoms of illness, we treat them aggressively. We'll do a steroid, we'll do inhalers, we'll do an antibiotic just to prevent any further complications or hospitalizations. So that is something, that's why I always tell my patients, educate yourself, don't just rely on me. Don't just rely on me. I like when they come to me and they ask questions and they already have their information at hand. So educate yourself, ask your PCP, do you think I should be on a steroid? Do you think I need an inhaler? Do you think I need an antibiotic? And take it from there. But like I said, if she's not having any symptoms, then there's no reason to treat her.
Okay, that's awesome. Okay, I think we've got another question. There's a question from a gentleman who says, is it an additional protection to wear goggles to prevent any infectious mist into getting into the eyes?
So again, COVID-19, as well as the flu, is a respiratory illness, meaning that the droplets are dispersed into the air. If the droplets come in contact with the mucous membrane, including the eyes, the nose, the mouth, you're at risk for contracting the virus. So I do see people with goggles. Do I recommend it? I think it's totally up to that individual. Goggles do offer that added protection. In the healthcare field, we do wear shields to cover our face, but it's not 100% necessary. If you're remaining at least 6 feet from that individual and you're wearing a mask, you don't necessarily have to wear goggles.
All right. Do we have any more questions? We have one more question. Okay. The question is, would you recommend people use surgical masks or N95 respirators?
So the N95 respirators, we're trying to reserve that for healthcare and frontline workers only. As long as you're wearing a surgical mask are easier to find than N95. As long as you're wearing a surgical mask or a cloth face covering, that offers the same amount of protection. But for N95, if you're able to get it, fine, but we're trying to reserve those for frontline healthcare workers who are coming in contact with these illnesses every single day. So, like I said, if you can find it, let me know, because there is a shortage, but as long as you're wearing a cloth face covering, you're fine.
All right, thank you so much. We're gonna wrap this section up, but we'll get back with you, okay?
All right, thank you.
Thank you. So the next section that we're going to go to is we're going to go to Dr. Tulu McKenzie, who's going to talk about COVID-19 in children. And I'm just going to do one, we've got some teachers and a lot of parents on the line right now, and they're all very concerned. And of course, we've seen on the news or people just making comments that children do not get COVID the same way that adults get COVID, so there's not a problem. And Dr. McKenzie is going to clear this up for us. So Dr. McKenzie, take it away.
Good evening, everybody. Thank you for the opportunity just to speak with you all today. What I wanted to cover are basically 3 things that I want you to have a better understanding of when you leave here today. So now the first question, well, can children get sick with COVID-19? Now, although fewer children have been sick with COVID-19 compared to adults, children can be affected with the COVID-19 virus. They can get sick from COVID-19 and they can spread the virus to others. And just like adults, children who are asymptomatic, so they're not showing any symptoms, can also spread the virus to other people. And data is also showing that Black and Hispanic children are being disproportionately affected with COVID, similar to what we're seeing in adults. Dr. Patil went through some of the symptoms, common symptoms with COVID, and in children, We usually see fever and cough, but they can also display other symptoms of COVID-19, such as loss of taste and loss of smell as well. Now, also similar to adults, children who are at high risk for serious disease with COVID include children who have asthma or chronic lung disease, children with diabetes, children who may have genetic or neurologic or metabolic conditions. So, for example, children with Down syndrome, children who have sickle cell disease, heart disease, children who may have immunosuppression, and that could be due to a certain medical condition where they have a weakened immune system, or there are medications that can also weaken the immune system. So those children are also at risk for COVID-19 infection. Also kids who have medical complexity. And when we talk about medical complexity, that means children who have multiple chronic conditions that affect many different parts of their body, kids that require technology. So, there are some kids who may require a breathing tube or other sort of supports just for their daily lives. And those children are at risk. And then finally, children who are obese are also at risk for severe COVID-19 infection. Now, a common question that's also been asked is, well, why do children react differently? Although children can get sick from COVID-19 or have COVID-19 infection, sometimes the symptoms tend to be a little bit milder. And some experts suggest that children may not be as severely affected by COVID-19 because there are other coronaviruses that can spread in the community and cause diseases such as a common cold. Children typically get the common cold, so is their immune system more primed to provide some protection? It's also possible that children's immune systems interact with the virus differently than do adults' immune systems. And we see that some adults get sick from COVID-19 because their immune systems essentially overact to the virus, causing more damage to their body. And so this may be less likely to happen in children. But something that we are seeing in children is a condition known as MISC. And MISC stands for multi-system inflammatory syndrome in children. And experts aren't sure what causes MISC, but essentially with MISC, different parts of the body become inflamed. Your heart, your lungs, your brain, your skin, and it can be serious and even deadly in children. And some common symptoms that may be suggestive of MISC is fever, abdominal pain, rash, or even difficulty breathing or confusion. Now, in addition to the physical health of our children that COVID-19 can impact, we're also seeing that the COVID-19 pandemic can affect a child's mental health and well-being. We know that traumatic experiences can affect normal child health and development by causing a toxic stress response. And I liken it to you're walking in the woods and you see a bear, and that your flight or fight response kicks in, you run away from the bear, and that response turns off. Now with toxic stress, instead of finding safety away from the bear, that bear follows you everywhere that you go. So your flight or fight response never turns off. And the economic hardships that people have been going through with the COVID-19 pandemic, as well as the fear and anxiety that people are facing, can impact the social and emotional development of our children. And this can manifest as new behavioral issues. It can also manifest as developmental aggression. And that means that we have kids that used to be able to do certain things that can no longer do those things. So, kids used to be able to, speak in sentences, and, they're showing some aggression in terms of their speech, for example. And as well, I'm seeing a lot in our children or adolescents, new mental health issues. I think that's something that I've commonly seen, especially when I'm doing my well child checks, or really a lot of teenagers with new issues with depression and anxiety during the pandemic. And given the inequities that we're seeing with COVID-19, it means that a significant number of our children are going to be at higher risk for these social and behavioral impacts. And in addition to just the economic hardships of fear and anxiety, many children have not been in-person school since the pandemic. And we know that schools and school-supported programs are fundamental to child and adolescent development and their well-being. And the American Academy of Pediatrics, or the AAP, which is the governing body for pediatricians, they advocate that the goal should be to have children physically present in school if it's safe. And there's also been new research that suggests that schools have not been a significant driver of COVID-19 transmission in their communities when they are taking safety precautions. Now, I mentioned and I talked about the fact that the COVID-19 pandemic can have an impact on a children's social, emotional, developmental well-being. Now, what can we do to help mitigate some of those effects? Well, a key protective factor when it comes to toxic stress and traumatic experience is really social support. As parents, as educators, it's important to remind children that they're safe and allow them to share their feelings openly. Also, kids thrive off of consistency and routine. So as much as you can provide routines, especially with virtual learning, it's easy to take class from your bed in your pajamas, but it should be a routine of still getting up, brushing your teeth, getting dressed, getting out of your bed, sitting in front of that computer for class. In addition, you should still celebrate life events. I think it looks differently, of course, with taking the proper social distancing and safety precautions. So whether it's, you get an A on your test and we're gonna, celebrate with some friends over Zoom, or it's your birthday and we're going to do a birthday parade, we should still try to find ways to celebrate those important moments in the child's life in order to provide them with that, again, that sense of safety and routine. And then also, kids should still go to their pediatrician. They should still get their well child checks. One of the ways we identify children who are having struggles with the pandemic has been just a screening that we do as pediatricians. Kids should still get their vaccines during the pandemic. And we're encouraging, our patients to come in and to get vaccinated so that they remain on track with their vaccine schedule. And then really encouraging our children and our families to continue to eat healthy and to be physically active. I think we all can say we probably gained the COVID-19, 15. And I'm seeing a lot of growth charts that are starting to go straight up from March. So it's important to be cautious and important in order to stay healthy and to make sure that our children are staying healthy and staying protected during this time. And just to close, I just want to mention that we all know that pandemic fatigue is a real thing. Being away from family and friends is challenging, but we have to look at it as we're making that decision to help people that we care about, but also help, our neighbor up the street and people that we may not know in, other cities, other states. It's a decision that we make to make it not about us. So I'll stop there and see if there are any questions.
So, Doctor, we do have a few questions for you. All right. So the first question is, as a teacher with live students, I wear glasses with a large frame and a face shield. Does this make a difference?
So I think, again, Dr. Patil talked about, wearing a face shield and just the way that COVID-19 spreads. So I think if you want to wear a face shield, it's just another source of protection. I think key is making sure that you're also wearing a face mask along with the face shield. But I think it's fine to continue to do the face shield and the glasses as long as you are wearing a mask.
I want to ask another question kind of along those lines. A lot of teachers now have plexiglass in between them and their students. Do they also need that added barrier with the face shield and the plexiglass?
Yeah, so the big thing is making sure that you are 6 feet, because that is to help protect to help prevent the spread of the respiratory droplets. I think that the challenge with COVID-19 is that we're learning new things about it every day. If it's you can always lean on the side of conservatism, especially because we're learning new things about COVID. So will it hurt to continue to wear face shields? No. I think that's something that you could continue to do if that's what you feel comfortable doing.
Okay. Um, Now I'm not sure about this question, but we might have to bring this back down a little bit long. What supplements, and you're a pediatrician, what supplements should parents be giving their children to help them possibly fight off or, boost their immune system?
Yeah, so I think the best way to boost your immune system is to eat healthy, to be physically active. And there's no magic fix. There are no magic supplements when it comes to boosting your immune system. If you're eating a varied diet, if you're staying active, for adults, it means no smoking. It means no smoking, drinking in moderation. That's really kind of the magic bullet to having a healthy immune system.
Okay, so just another question. We're talking about, here's a question. Anything else, is there anything else teachers can do to protect themselves and their own families besides washing their hands and wearing a mask when it comes to sharing materials?
Yes, so we recommend from a public health perspective, in order to help prevent COVID, the spread of COVID, is really wash your hands and wear a mask and try to socially distance as much as possible. And that's really going to be the key strategies to stay healthy and to protect yourself from COVID.
Can you answer the question of why COVID might affect an overweight child more than it would affect a more normal weight child?
Yes, we know, similar to adults, children who um, are obese are also at increased risk for other comorbid conditions. So things like diabetes, things like high blood pressure, which are all chronic conditions that ultimately make your immune system a little bit weaker and not as strong as somebody who doesn't have those conditions. So it's the same way that we see COVID-19 affecting adults who may be severely obese. It's just a matter of your immune system not being as strong as it needs to be.
Okay, so I have a question from the chat. It says, I have an honor roll student, and she's been an honor roll student her whole life. And since October, she's really been struggling. And her parent thinks this is due to no in-person school since March. She's a 10th grader and misses social interaction. She's struggling with her work. Is there anything to, any tips to help her with her struggle and to keep her grades up? Because this is, psychological as well for the children.
Yeah, absolutely. And I would say that this is something that I'm commonly seeing with my adolescent patients in clinic. And, when I have parents bring in their children and they're saying the same thing, that they did fine, and now all of a sudden they're not acting like their normal self, they're not making the grades that they used to make, I screen them for anxiety and depression, and I recommend behavioral counseling because We know, like I mentioned, that this pandemic is having a serious effect on a child's mental health, and the opportunity to just speak about it to a counselor. There's telehealth for behavioral health services that's available. So I've been doing a lot of and making a lot of recommendations to behavioral health counseling, and as well in situations, encouraging the parents to speak with the teachers. I have patients too who have special healthcare needs, have kids who have ADHD, for example, and they've had to make, some concerted efforts to make sure that, in the midst of the pandemic, when they're doing virtual school, that they're still having their needs met. And I would encourage, families that have children who have 504 or IEPs to try to find ways to still get the children the services they need with a conversation with their teacher.
All right. Thank you. Thank you so, so much. We're going to move on to the next panelist, but thank you, Dr. McKenzie, for everything. You're a rock star. Yay. Okay, so we're going to go on to Dr. Powell next. And she's going to talk about, I have COVID. What's next? So, Miss Afro Puffs.
Good afternoon, everyone, and thank you so much for having me on the panel today. So the first order of business, I am not a doctor. Thank you so much to our lovely moderator for giving me such a privileged title tonight, but I am not a doctor. I just want to clear the air with that. But now, since Dr. Batil and Dr. McKenzie have brought you to the point where you've been diagnosed, now for you to understand how were you diagnosed. That comes in multiple factors. So now understanding your diagnosis. At some point during your doctor's visit or your stay or in a hospital or urgent care center, one of the three methods below was performed. The first was a PCR method, and that's when it comes to the laboratory. This is a test where they, as we love to describe it in the lab or in a hospital setting, that this is a nasopharyngeal swab where it's a tiny flexi swab that is submerged into your nares, and it goes, as we call it, all the way to the brain. This swab is very flexible, and at this point, this method is, as we consider, the most definitive method for testing. Also with a PCR test, you can also have a nasal swab, which is done very close to the nares. This is when they only go to as far as your mid-turbinates. Not as painful as a nasopharyngeal swab, but can yield the same results. So with a PCR test, it detects the genetic information of the virus. And this is looking at your RNA. The PCR test is used to directly detect the presence of an antigen and can tell whether someone has the virus much early on than it can with the other two methods that I will speak about later. With an antigen test, very similar to the PCR, the same swabbing technique is used, but with this particular test, you are looking at the proteins. An antigen is a molecule capable of stimulating an immune response. And as I stated, it is looking at the protein that is attached to the virus itself. This is on the outer surface of the virus. So if someone was to do an antigen test on you, 20 minutes between each one, in the laboratory, we would not accept that second one because it takes the virus a little while to develop more protein on that particular, on that molecule itself. Then the third method of testing is the antibiotic testing, which is serological testing. This one is a blood sample. And unlike the PCR test and the antigen test, as I mentioned, those are both swabs. With the antigen test, this is a blood sample. And blood samples are used to detect or for us to look at your IgG and your IgM. The IgM is the antibody that lets us know that you are at that moment infected with COVID. Your IgG, it will let us know more about your immunity or that you've been exposed. And we don't really focus a lot on the serological test, especially IgG, especially in the earlier parts of the pandemic, because there are 4 other viruses that are closely linked to that IgG antibody. So in order to ensure that we are giving you the proper diagnosis, if this was your first diagnosis, we would highly recommend that one of the other 2 methods were used in order for us to diagnose you with COVID, being the PCR and antigen. So now that you've been diagnosed, what do? You know that you've had one of the 3 methods performed. Now it's time for you to quarantine. Quarantine is to keep someone who has been in close contact with you, or someone that you know that will be in close contact with you, away from you. The CDC recommends that individuals stay home for 14 days after your last contact. During your quarantine, we recommend that you check your temperature twice a day and monitor your current and developing symptoms. And if possible, stay away from people who are at higher risk. Dr. McKenzie and Dr. Patil, they spoke about those level of people that are considered a higher risk group. So try to stay away from those people. In addition to that, which some people hate to do, is isolation. Fortunate for me, my daughter, I have a 15-year-old daughter, and she is a true introvert. So this has no bearings on her. So if it's a true introvert, if you're a true introvert, isolation does not bother you. But for those of us that are more outgoing, we need to isolate. Isolation is keeping someone who is sick or has tested positive from COVID-19 without symptoms from others. Everyone that has been in close proximity with you, that once you've been diagnosed with COVID, they need to be notified. And as I mentioned in my last slide, you need to self-monitor. Self-monitor if any of your signs or symptoms start to progress, or if you were not diagnosed with they stated that there is a possibility, because one of the other tested methodologies did not rule it out, still isolate yourself, monitor yourself, because there are times when at the time of testing, the virus was not there, but if you test a couple of days later, the virus may be there. So isolate yourself. If you tested positive for COVID, but do not have symptoms, stay home until after 10 days have passed since your positive test. Remain in isolation until you have 2 negative COVID results within 24 hours of each other, and you should wear a mask, practice proper hand hygiene, which good hygiene, and hand washing, and do not share household items. After that, what we need to do is always inform and designate. We never think that this will happen to us, or what happened to the last person may not happen to me. We don't know. Most people that are infected with COVID, they may display only mild symptoms, very flu-like symptoms. So that's why, as Dr. Patil stated, there is a big COVID and flu mimic each other a lot. So just inform yourself and designate, because just in case your symptoms progress, you need to have someone there that can speak up for you or be there as your advocate, just in case you have to go into the hospital or, as I stated, your symptoms progress. If you're home isolating, you should inform your healthcare provider of any of the following symptoms: difficulty breathing, the flushed face, the confusion, loss of smell or taste, seizures, to persistent chest pain or pressure, inability to talk or be aroused, and a fever that's greater than 100.4 degrees Fahrenheit. This virus is, as I love to say in the laboratory or in the hospital setting, this is one virus that is not prejudiced at all. This virus, it will infect, or it can, the issues that it can cause to everyone is totally different. So just because a family friend or someone you may know or something you've read stated that these were their signs and symptoms, just because you may not have all of those, do not ignore it. because ignoring it is meaning that you may have lost that opportunity for you to be tested. Don't ignore the signs or symptoms because it presents differently in everyone. And if you have been diagnosed and you are at home self-isolating, Dr. Patel, she did cover the 9 points that are in my slide here. If you are immunocompromised, diabetes, obesity, have had a previous stroke, organ transplant, those are put you in that high risk group. So if you are at home and you are self-isolating, uh, select someone to be your healthcare advocate, and select someone that is not in that high risk group, because that person will need to be there for you to step up to say, or to be that person, your voice of reason, just in case your condition worsens and you have to be hospitalized. I think one of the other doctors will be covering this, but currently only one antiviral drug has been received and has received an EUA. And EUA in the laboratory and in the healthcare world, that is called a emergency use authorization by the FDA. What that means is that because of the pandemic, the FDA had to approve everything rapidly. All the testing that's done, the vaccines that are out and available at this point, they all receive what is called an emergency use authorization. This is that they ask so many participants to enroll in a clinical trial. And once that enrollment is done, the FDA has a certain number of a participant that needs to be enrolled. And once you are able to fulfill that requirement, you can submit your paperwork to the FDA for you to receive an emergency use authorization. So at this point, the treatment for COVID-19, there is one, remdesivir is a antiviral drug that has received a EUA, and together with your healthcare provider, and knowing that you have this antiviral drug, it can develop, and you have these certain signs or symptoms, they may administer that one drug to you. There is another method, it's called convalescent plasma, that once you are in the hospital and someone has tested positive, and now you can donate your plasma after you go through this series of tests to see if your blood is compatible. And we will receive that blood, and it can be administered to a patient that is in isolation or on a ventilator or is COVID-19 positive. But again, it is important for you to stay home until you're no longer contagious, even if your symptoms are gone. And Dr. Patil did touch on this. When we say your symptom, you may be symptomatic or asymptomatic. So at this point, you are asymptomatic, you don't have any signs or symptoms, but that does not mean that you're not spreading the virus. The other thing is it is very essential for you to follow your healthcare provider's guidance about when it is safe for you to interact with other people. If you have been tested for COVID-19 and received a negative result, if you may leave home after meeting all of these three conditions. The first, have no fever without using any fever reducing medication. Shortness of breath and coughing have improved. Thirdly, you received 2 negative COVID-19 results 24 hours apart. Some hospitals or some workplaces, what they will recommend is that those 2 COVID-19 results are done by 2 different methodologies. Well, I spoke about the different methodologies at the very beginning of my presentation. Some would want a PCR negative test and then an antigen negative test. If you have not been tested for COVID-19, you may leave your home after meeting all of the 3 conditions. Those 3 conditions are have no fever for at least 72 hours without using any fever reducing medication, shortness of breath and coughing have improved, and it has been at least 7 days since your symptoms first appeared. So it's very hard to bring in some of these questions that were asked by our lovely moderator and the group itself. How these frequently asked questions, how can I prevent COVID-19? Dr. Patil and Dr. McKenzie, they spoke about it in depth. But the main thing that we all need to know is to social distance, proper hand hygiene, which is hand washing, masking, social, as I stated, social distancing is key, and masking and proper hand washing. Always cover your mouth and nose with a non-surgical mask or a cloth face mask that should be worn at all time. One of the questions presented to one of the other panelists was if a N95 respirator or a surgical mask, what was the difference? Or should you use an N95 respirator? As Dr. Patil stated, in the hospital setting or any first responders, N95s are so critical to us because in the hospital or when you are a first responder, you are in direct contact and you have to be sometimes closer than 6 feet to your patient. And because of that, the N95 protects us more. That's why she stated we want to keep that for our healthcare practitioners. So a surgical or a cloth mask will serve the purpose, especially if it's worn the proper way. Avoid crowds and practice social distancing. We cannot stress that enough. I'm sure everyone on this panel will continuously say social distancing. Just stay away from large crowds if you have to, or you really need to. And because that is key in order for us to stop the spread of this virus. One of the other questions, and I hear this a lot, is that spraying Lysol. Some think that spraying Lysol will kill coronavirus. Coronavirus, yes. In the normal flu, the coronavirus is present. SARS-CoV-2-19, it will not. It can help decrease the spread of, but it will not kill SARS-CoV-2-19. If it would, we all would be millionaires because we would be out there trying to patent Lysol. Lysol is not used for that. So if you are going through a tunnel, a tunnel of some sort, they have all these aerosols, it is to minimize, but it will not kill SARS-CoV-2.
All right. I just still want to call you doctor for some reason, but Sandra.
That's fine, yeah.
I have 3 questions for you. Okay.
Not
So the first, one of the questions is from retired Judge Holmes, actually. What is the difference between the KN95 and the N95 mask?
the KN95, honestly, I have not heard of a KN95. So I don't know if one of the other panelists have heard of a KN95 mask, but at this point, I have not heard of a KN95.
Okay, so we'll go back to that one a little later on. The second question is it necessary to isolate for 10 days? If someone tests positive and then tests positive prior to the 10 days and then gets a negative test, can that person come out of quarantine?
If the person received a negative test after 10 days, should they come out of quarantine? Was that the question?
No, I think I'm going to read this exactly, okay?
Okay.
Is it necessary to isolate for 10 days? If someone tests positive, then tests positive prior to the 10 days and gets a negative test, can that person come out of quarantine? I asked
Yes,
because
I can take it from there. My answer would be no. And I say no because if they received a negative result, sometimes in the laboratory, it will be a negative result. And that negative result can be because you tested too soon. And even if when I spoke about that everyone that you've had come in contact with, they need to be tested, but you should not test too soon. Testing too soon can yield a false negative result. That's why we always recommend that you wait at least 7 to 10 days after being in contact with someone that has tested positive for COVID before you go and test. If you've only been in contact with this person in the last 24 hours, the likelihood of that virus being in your system is not there yet, but 7 to 10 days later, it could be. So if that person had a negative result, then a positive result, no, still isolate yourself, and that person should remain in quarantine.
Okay, so now this next question kind of talks about the testing as well. If someone gets a negative result with a rapid antigen test, do you encourage that individual to now get the PCR test?
I would, especially if they're symptomatic. If they are symptomatic, they should always, always follow up with a PCR test, because the antigen, as I stated, is looking at the protein. And even the disclaimer that's out there by the manufacturers is that every antigen test should receive confirmatory by a PCR label test.
Okay. Now, if someone is getting retested following a positive COVID test and a 14-day quarantine, do you recommend a nasal washout prior to the following test for an accurate result?
No. And I say no because if the depending on, I don't know where you're going to go for your testing. If you're going somewhere that only do a nasal or NARS test, that's when it's only going up to the mid turbinates, or if they're only have the ability to administer the antigen test, that can clean away or wash away the protein that is found on that spike of that virus itself. So cleaning out or doing a nasal wash, it can remove all of the protein that's there. You go in for your swabbing, because that protein is not there, it's going to come back as negative. So do not do the nasal wash. Go in and let them swab what's there. Yes, there could be some residual there, but it's best for you to know that you're still positive, but not exhibiting any symptoms, instead of thinking that you're negative and going out and infecting others.
That's a great answer. That's such a great answer. Now, here's a great question. Do you know if there's going to be an at-home collection or testing available?
There are multiple vendors out there that have released their at-home testing methodologies. In the hospital setting, trained nurses, doctors have difficulties collecting a proper sample. When it first came out, me being a laboratorian and in clinical medicine, the first thing I said was, this is ludicrous, because we see trained nurses and doctors in the hospital setting that's not able to get a proper sample. Now, for someone at home to say that they're going to go as far as they need to go, meaning as follow the directions and go into your NARS as high as you should, to actually obtain a proper sample, I don't feel it will be as accurate as it should be. But again, this is me knowing what I know in my laboratorian background. So there are multiple vendors out there that have released at-home testing.
Goodness gracious. So basically, bottom line, you don't recommend it if they do release it.
If you are symptomatic, just go to the hospital, call your healthcare provider. If you decide to use one of the at-home tests and you render a negative result and you're symptomatic, follow up with your healthcare provider. If you receive a positive result, follow up with your healthcare provider. That is my claim to fame. Follow up with your healthcare provider.
Okay, all right. Thank you so much for this section. Such an informative section.
Thank
So
you.
now we're going to move on to Dr. Denise Bedeau, but don't go anywhere. Okay. Hey, Dr. Bedeau.
Good evening. How are you today?
I'm good.
Awesome. Well, I just want to first of all say thank you so much for this opportunity to share value with you all. And I just want to echo all of the previous panelists in that this is a serious matter and that facts over fear is to be highlighted. So I am going to focus on vaccines related to COVID-19. And first, since I am a professor at the university, or assistant professor, let's not be rash. Since I'm an assistant professor at the University of Miami, I do want to say I have no disclosures. The University of Miami was involved in a clinical trial. Well, they're involved in multiple, but Moderna was one that we had a clinical site for. I was not involved in that clinical trial, so I have no disclosures. Next slide, please. So again, to echo the previous panelists, we know that mortality from COVID-19 is elevated among those with chronic conditions and specifically among those with high-risk groups. I'll go ahead and yield because we've talked about this often this evening. So what I would like to do is really focus on getting everyone to baseline. First of all, I just want to center my lens of where I come from. So yes, I am an epidemiologist at the University of Miami, but I'm also a first generation college, student, college graduate. And what I want to say to you all is that information matters, where it comes from matters. And even within my own family, there's dissonance in, how we're approaching the vaccine or COVID itself. So I just want to start off, first of all, by saying that this is, and I recognize and want to hold space for the fact that this is a spicy matter, for lack of a better term. And I want to give value to that. So I want to just educate on what a vaccine is first, and then we will go ahead and talk about the two types that are FDA approved at this moment. So first of all, the key terms here are immunity, a vaccine, vaccination, and immunization. So immunity is really what the protection of an infectious disease. That's what we're going for. If you are immune to the disease, you could be exposed and not be affected. The vaccine is the product that actually stimulates a person's immune system to produce the immunity to a specific disease. Here, we're talking about, of course, SARS-CoV-2. Then the vaccination is the actual act of introducing the vaccine into the body. And the purpose, of course, is to produce that immunity to a specific disease. And then finally, the immunization is actually a process by which a person becomes protected against the disease through the process of vaccination. This term is usually interchangeable with vaccination and inoculation, but I just want to be clear that the vaccination is an act and the immunization is a process. And it's important here because COVID-19 vaccine in particular have two doses. So that is one reason. The other key terms, next slide, please. Thank you. Also, I want to highlight that at the bottom of the slides, I have references. Don't believe me, watch, go look your own evidence. I was just going to start singing because when I always talk about this, I always don't believe me. Like, I want you to believe me, but I also want you to empower yourself with evidence. So please be encouraged to go to those websites that I have at the bottoms of the slides. So the previous one was for this. So how do our bodies actually fight these illnesses? Well, first of all, we have these red and white blood cells within our systems. The red blood cells carry oxygen to the tissues and to our organs to continue with functioning. Then we have white blood cells. So these are the blood cells that we're going to focus on the most this evening. And these are the immune cells that actually fight the infection. So within the white blood cell category, there's three major types. One is the macrophages, and these are the white blood cells that swallow, digest these germs. They also swallow and digest dying cells, dead cells. So often I talk to my study participants about fasting, especially when exposed to COVID, and it's because of this reason. There's clinical evidence that shows that fasting does kill off certain cells. So in this instance, these white bloods will then swallow those dead cells, etc. Now, the key part here is for everyone to pay attention to is that these white blood cells, after they're done swallowing and digesting these dying cells, they leave behind what we call antigens. And these antigens are parts of invading germs. So it's kind of like crumbs they leave within our systems. The body is then stimulated to attack them and create these antibodies. So next type of white blood cell that's important to note is a B lymphocyte. These are the defensive white blood cells. So thinking of football, these are the ones that go in, all right, so we're not trying to get the virus, so let's make antibodies to attack these germs. And then finally, we have T lymphocytes. And these are also defensive white blood cells, but these are the ones that are attacking the already infected. Next slide, please. So now that we understand the terms, let's talk about how the COVID vaccines work in general. So again, COVID vaccines help our body develop this immunity that we're aiming for. And it's immunity to the virus, the SARS-CoV-2, that causes COVID-19 without us having to get the illness. And I just want to pause there and reiterate that the two vaccines that are approved by the FDA, they do not give a piece of the virus to you. There are other vaccines that do that, and the flu vaccine is one of them. However, I want to again reiterate that the COVID vaccine that are approved, they do not give a piece of the virus in the sense of similar to other vaccines. So here, different vaccines work in different ways, again, to reiterate, to offer protection. But the key underlying fact here is that the body is left with what we call memory T lymphocytes and as well as B lymphocytes. And remember, these are the defensive players within our body. So typically it takes a few weeks for our body to actually produce these defensive white blood cells. So it is possible that a person could be infected with the virus that causes COVID-19 just before or just after vaccination. So remember what Dr. Batil was talking about with the incubation period and also the onset of symptoms. So just I just want to reiterate that as well. Next slide, please. So again, here, this is a direct screenshot for what we have actually in our clinics here at the University of Miami. So what I did, it's from the FDA and it's vaccine facts. The website is below, so feel free to download and use yourselves. But what I would like to highlight here is that there is an advisory committee on immunization practices. And this is an advisory committee that exists, period, when it comes to vaccines. So it's not like it was just created for the COVID-19 pandemic. But this is a group of medical and public health experts, and they advise the CDC. It's a very collaborative representation of about 30 organizations that bring experts from multiple backgrounds. So the point of this slide is that when creating vaccines, they don't just kind of make it to the shelf, to the consumer. There's plenty of research. And as an epidemiologist, and I know I share the panel with another epidemiologist, we can attest to, there is multiple layers of data that needs to be collected, analyzed, disseminated, replicated, and distributed before we can move forward. So what did the ACIP pay attention to? How safe is the vaccine given a certain amount of ages, time, how serious is the disease that the vaccine presents, and et cetera. So last thing before we move on to the next slide is that the ACIP actually makes these recommendations and they're not official until the CDC director of reviews and approves it. So again, there's multiple layers to getting this approval. So now that we have a vaccine that's approved, what happens, right? We don't just stop thinking of it, especially if you're an epidemiologist. And I say that with a lot of emotion because I feel like I've been breathing COVID since, last year. So anyway, so we don't just forget, right? So we track it. And the way, and I say we because I'm talking about the healthcare professionals as a collective, but the FDA and the CDC closely monitor, and this is the actual process by which it's monitored. So we have multiple layers. So first, there's the vaccine adverse event reporting system. So this is something that we all can log in and kind of see what's going on because they have reports. There's also a vaccine safety data link. That's a collaboration between the CDC and some healthcare organizations. So they're collecting real-time safety monitoring of vaccines. And then there's also the Clinical Immunization Safety Assessment Project. So this is, again, another collaboration with the CDC and then 7 medical research centers. And then finally, when it comes down to the actual participant or patient that's receiving the vaccine, there's something that's called VSafe. And this is after the vaccination you receive, you can go ahead and have a health checker and you can report your symptoms in real time. And the reason why I'm highlighting this is because silence is not a forte in this sense. If you happen to have received the vaccine and experience any symptoms that are beyond what a normal, and I will discuss what we would consider a typical side effect of a vaccine is, make sure you report that. And I'll just leave on that. Thank you. So now that we hear how we actually get to the process, what's the purpose of a vaccine, I'd like to now talk about the 2 types of vaccines that are approved by the FDA as of this month. Again, things can change, things change rapidly, and we like to say this in the healthcare that it's a rapidly evolving situation. So as of this moment in time, these are the 2 that are approved. We have the Pfizer and BioNTech, and then we have the Moderna. So the key difference before I even move on is One of them must be mixed with a diluent before use, and that's more important for the healthcare providers to remember. And then the other one is not to be mixed with anything. And in fact, if there happens to be a vial that has any leftover, it is not recommended to either reuse that residual or mix it from another dose, nor is it recommended to mix the Pfizer and Moderna doses. So I wanted to start there just in case anyone happens to pass out, pass away away from this presentation and not want to hear it anymore. Let's just remember that we're not trying to mix these. We need to take it as the clinical trials have collected evidence for. So the Pfizer vaccine is a multiple dose. There's 2 doses. Each vial has up to 6 doses. That's not as important to know, but the important part here is the schedule and the ages. So the Pfizer dose of the Pfizer vaccine, that has clinical indications for 16 years of age and older. So what does that mean, clinical indications? Well, that means that there has been clinical trials that included those of 16 years of age and older. So there's evidence to show effectiveness. The dose is a 2-dose series separated by 21 days, and it's administered through injection site, usually at the arm. Now we have the Moderna. It's now here, the important part here to notice is, again, of course, please do not mix vials. But the other thing is that 18 years of age and older is the indications. And it's important to note that because clinical trials have not collected data on anyone under the age of 18, or at least they haven't published it, I should say, under the age of 18 when it comes to the Moderna vaccine. So if you have any 16 to 18-year-olds, it would be interesting to have you read the evidence for the Pfizer vaccine and the clinical trials. Thank you. Oh, and one more thing too, just you don't have to go, well, okay. The other thing about the Moderna dose is that it's a 2-dose series. However, instead of 21 days between doses, it's 28 days. So that's important to note. Thank you. Now, a little bit, I am a very evidence-based person that I like to always, again, share the references. So here I, again, place the reference. This is the data directly from the Advisory Committee on Immunization Practices. What they did was they reviewed the evidence from Pfizer, their clinical trials, and all of the appropriate evidence, contributors, and they summarized it. So based on the body of evidence for the Pfizer vaccine, and they found that it was a 95% effective vaccine in preventing symptomatic, laboratory-confirmed COVID-19 in persons without evidence of previous SARS-CoV-2 infection. I'm going to repeat that because that is very, very important to note because of the effectiveness. Now, first of all, 95% effectiveness is quite high. And to give a little bit of context, the flu vaccine typically ranges in effectiveness between 30 to 50%. And it's a range because it also, similar to this, there's multiple versions of the vaccine for the flu. But in a population of more than 43,000 participants with a mean age of 92 years, so again, here's the range between 16 to 91 years old, they had a 95% effectiveness. And the effectiveness was preventing symptomatic. So the other thing is that it was effective in preventing it for those who did not have evidence of previous infection. And then the other thing to note here, and again, you can look at the website and actually look at the numbers yourself here, that consistent high efficacy, which above 92%, was observed across age, sex, race, and ethnicity. So that's important to note. Next, we have the Moderna vaccine. And again, I have the information here that was released in the MMWR from the CDC. So here they had a population of about 30,000 participants in their clinical trials. Their trial, actually, let me correct myself, I apologize. It was one large randomized double-blind placebo-controlled clinical trial. And they had 30,000 participants aged 18 to 95. And that's what they're reporting on this data here. So what they found with the Moderna vaccine is that quite similar to the Pfizer vaccine, it was a 94.1% effective. And when you see the confidence interval, what it's saying is that the data after the statistical analysis controlling for other variables that may impact it, it can range anywhere between 89.3% to 96.8%. So either way, at the lower range of this effectiveness, at an 89.3% effectiveness, that's quite high. And again, an 86% here with high efficacy was observed across age, sex, race, and ethnicity. Thank you. So what is so different about the COVID-19 vaccines? So previously in this conversation, I started off by mentioning that there's no live virus that's being put into our systems. So here, what's so different about COVID? This is working through a messenger RNA system, which we denote as lowercase m RNA. And this is most easily described as, and you can find this again also, the link is not showing up because it was in black, but you can find this on the CDC. This is directly from their websites. So RNA can most easily be described as basically the instructions. So what's the blueprint? What are the instructions? Once the protein is made, what are we gonna do with it? So the mRNA vaccines, not only have they been studied before, but this is what's being used for the COVID-19 vaccine. So one thing I want to highlight here, because I have seen frequently asked questions from our study participants that, oh, it just seemed really quick. COVID-19 just got here. How do we have a vaccine? Well, mRNA vaccines in itself, the actual methodology and the fundamental idea of the mRNA vaccine process, they have been studied before for previous versions for the flu, Zika, rabies. So once information was gathered regarding COVID-19, those scientists who have already had the experience in collaborating on the mRNA vaccines in other disease systems were able to translate that. And I just want to highlight that, one, because I am a fellow scientist, and that is science in action, and that makes me happy to say. And I just want to highlight that because it didn't just get here. Next slide, please. So one thing to note, aside from what has been collected in the clinical data and the evidence that we have been presenting through all of the presenters here this evening, is that according to the CDC, there are still some pockets of the population that either should not get vaccinated or should have a serious conversation with their healthcare provider. Again, the link is down below, and this is particularly from Pfizer, although the Moderna vaccine had the same exact populations listed here. So first of all, if you have had a severe allergic reaction before, or an immediate allergic reaction, even if it wasn't severe, to any ingredient in an mRNA COVID-19 vaccine, you should not get the mRNA vaccine. And you would know this if this was you. It's rare, but you would know. And again, on that website that I have listed here, you can actually see the ingredients. One thing to note, there are no eggs in there because I know that is something that people were often, especially if you're a vegan, that you don't have to worry about that aspect. Next, if you've had a severe allergic reaction or immediate allergic reaction, even if it wasn't severe, after getting the first dose of the vaccine, you should not get the second dose. Now, I would like to highlight there, and there's an asterisk, and the asterisk portion was cut off here by me, but feel free to go to the website. That means talk to your healthcare provider. And we had our previous speaker mention that often. I cannot underiterate. I think I made that word up, but it is important. Next, an emergent allergic reaction means within 4 hours of getting vaccinated. So pay attention to that. And again, last thing that I want to note, if the reaction is similar to those of flu, like just, side effects, pain at the injection site, nausea, then that is one thing. But if your side effects are loss of taste or smell, respiratory, cardiovascular implications, contact your healthcare provider. Next slide, please. Now, finally, I'd like to wrap up in talking about the phases. One thing to reiterate, because I recognize that this is being live, it's not just Florida who may be watching. Information varies by state. So what I'm going to start off with is the CDC recommendations, and it was a presentation done by a representative from the ACIP. So you can find the whole meeting. They have the entire presentation available if you'd like to know more details, especially for the teachers. I know that there's a lot of healthcare workers and teachers in the audience, so feel free to go there. So the National Academy of Science and Engineering Medicine, they have a phase outbreak, or a phased rollout plan, and it's listed here. Next slide, please. what I'd like to talk about here is that often we get questioned on what's the definition of an essential worker. And so here, based on this presentation and based on the essential critical infrastructure on workers, they define an essential worker in two categories. One, a frontline essential worker, which is about 30 million people in the population based on estimates, and then other essential workers. So frontline workers are the first responders, firefighters, police, educators. You are frontline workers. You're frontline essential workers, teachers, support staff, daycare. Food and agriculture, frontline essential. Manufacturing, corrections, U.S. postal workers, public transit workers, grocery store. Thank you so much. Seriously, thank you for all the work that you've done. And other essential workers are there. And I, not that this less, let me just mention them, transportation, food service, finance, etc. They're also part of this essential worker category. Next slide, please. So in visual, in format here, these are the phases of the COVID vaccination from a federal level as partitioned by the CDC. You have the 16 to 64-year-olds with high risk medical conditions. Then you have those on the other side without, and then you'll see, the blue and the white. So within this Venn diagram, you see the healthcare professionals, frontline essential workers. So you see the phases by color there. Next slide, please. So what I'm going to focus on here is the local information. So in the state of Florida, the best site to go to is the Florida Health COVID-19.gov. Information has the potential to change by the minute, by the hour, by the day. So really, as you can see, when I updated the slide here, the information was available, updated as of 9:25 a.m. on Friday, the 22nd. So as of right now, the state of Florida is giving vaccines to persons 65 years of age or older or healthcare personnel with direct patient contact, residents and staff of long-term care facilities, and persons deemed extremely vulnerable to COVID-19 by hospital providers. Note that there are some locations that are only serving specific populations. For example, the University of Miami is giving vaccines to those within our UHealth population. So just be sure to go to this website. I cannot reiterate that enough. Next slide, please. In closing, I just want to say that I understand, and I again want to reiterate that there are lots of questions about vaccines, and I am one of them that questions, but I again go to the data. And when reading the data, I feel, and also recognizing the ACIP vaccine work group's recommendations, these proposed guiding principles, I believe, are important to close on. So number one is safety is paramount. So when creating these proposals, they were thinking of the equity that these safety standards will not be compromised in efforts to accelerate the COVID-19 vaccine development or distribution. The amount of trust that we have in that is important. And I just want to make sure, the fact that I want to hold space for that. Okay, because it is what it is. Next is the inclusive clinical trials. Study participants should reflect groups at risk for COVID-19, ensure safety. The clinical trial data did that, and we can see all the demographics, although we can see that there was low participation in certain racial and ethnic backgrounds. Efficient distribution. During a pandemic, this is the most important part. So I'm hoping that things are going to be efficiently distributed. And then finally, flexibility. And I'll just leave there. But again, thank you so much. Please, please, please review the evidence yourself. It's one thing for us to educate you, and our panelists did a fantastic job, but it's another thing to read it yourself and actually understand and apply it to your own health and the health of your families. Thank you so much for this time, and I yield back to the speaker.
Oh my God, you're so cute.
Thank you.
Okay. So we've got a lot of questions, and questions that any of our panelists can actually answer. But first of all, one of the questions that we have is, do we have any natural remedies that can help people prevent COVID? Anybody?
I was going to say, is this for anyone or
Anybody who wants to answer it?
I can answer that one. There are no natural remedies that will prevent you from contracting COVID or influenza, but there are remedies that help to boost the immune system, and that's what we want to focus on. because a lot of people think if they're taking vitamin D, if they're taking vitamin C, zinc also as well, those vitamins help to boost your immune system. So as Dr. McKenzie said, the more your immune system is working at its best, that helps to prevent your risk of infection. So that is my answer. That is the answer that I give to all my patients. That is my disclosure. No, the NIH does not support that. Studies do not show that these vitamins protect you against COVID.
So elderberry, no?
It helps to boost the immune system.
Okay, all right. Okay, so anybody else want to speak on that topic? No, no, okay.
Yeah, I just want to add, I mean, I think that, um, you know, there's a lot of inconsistent evidence just in terms of supplements and things like that. And I really want to kind of just reinforce the importance of living a healthy lifestyle, you know, eating a varied diet, exercising is really the key to having a healthy immune system.
Okay. The second question I have is, can anyone answer this question about the KN95 mask versus the N95 mask? Has anyone heard of a KN95 mask? Dr. McKenzie, you're laughing. No, no one's heard of this? It might be.
So, oh, I'll yield.
Go ahead, go ahead. Dr. Vido, speak.
I was going I was going to say, okay, so yes, there is a KN95 mask, and what it is that it's just produced differently. So the N95 mask have a special type of filter system that's within it that gives it that classification of N95. KN95 is just basically a lower, I don't want to even mention it as a lower grade. It's just a different filtration system within the mask that provides a different type of protection from respiratory particles or particles that could be inhaled respiratory. So the KN95 masks are actually the most prevalent masks on the system, in the market, I should say. And in fact, those who I was assuming I had one next to me because I usually do, that's the ones that are mostly sold, let's say online or at local stores. You'll notice that it'll have literally a KN95 engraved within it. The important thing to note there is that it's great, actually, you know, it's great to keep the filtration and dust, but that's really what it's produced to do, keep dust particles and that level of size. So it's not the same as an N95 mask is what the bottom line is. However, that's not to say that it's not a good mask. And in fact, it's probably a better mask than one, let's say a silk mask or one that you're creating yourself. So,
Okay. All right, so the next question is, do you need both doses of the vaccine in order for it to be considered effective?
yes, in bold, yes. And it also, it needs to be done in the proper protocol that it was suggested. So if you need to, once you go, and I realize I'm being quite, you know, because it's very important data wise to do it as prescribed. So if you have the Moderna vaccine, then you go 28 days for the second vaccination, and you don't go to get a Pfizer one if that appointment is available or earlier. You stick to the Moderna. If you get a Pfizer, then 21 days later, you get the second dose, and again, Pfizer. Thank
Okay,
you.
so do not mix vaccinations.
Not, and get them both, please.
Okay.
May I spend 1 second on why that's important?
Yes,
I
please.
want to highlight that for a moment because of the fact is that the reason why that we have 2 doses of this vaccine is because when you have the first dose, it's basically priming your body. So if we recall the slides that I was talking about the different white blood cells, the body needs time to create the defensive white blood cells to protect us. So if we only take that first dose, you may not have the actual amount of defensive players within your body to protect yourself from the virus. So you might be actually doing yourself worse by taking only 1 dose. Thank you.
Wow. Oh,
Yeah.
wow. Okay. Another question is will the Pfizer and Moderna vaccine protect against a new strain of COVID?
That is under review with the evidence. So since it is the new strain, of course, that's evidence, that's data that's being collected.
Okay. Um, this didn't come up, but we had a question about animals and if animals can transmit the COVID-19 COVID-19 virus. Can anyone answer that?
I'll take that question. There's not a lot of information about pets and the pets transmitting COVID to their family members or vice versa. So what we will always say and recommend is just to treat your pets just like you would do any other human. Just isolate yourself, but there's not enough data to support any of that information. But we just say just monitor yourself, quarantine yourself, isolate as much as you could or can, as if you were dealing with any other human. Because what we do know, and laboratory medicine and veterinary medicine, they go hand in hand. A lot of the tests that are done for humans are also done for animals as well. The same test is done to develop or to detect different things. So my disclaimer, as Dr. Patil said, was just to treat your pets just like you would treat anyone else, just isolate.
Okay, so I'm gonna kind of piggyback on this a little bit, okay? I had a strange conversation yesterday with a coworker who said that he was at a dog park and wanted to know if a person has the COVID virus and they play with their dog and they go out into they're 6 feet away, but they play with their dog, and can that dog carry the COVID virus to someone else who comes up and pets that dog?
Again, there's not enough information out there for us to, either of the panelists probably, to say yay or nay. So we would just say, just treat that your animal or just like you would do any other human. I know a lot of people have that myth because it's not a myth that it was started by the bats in China, but this is different because now we're looking at our furry animals. This is not droplets into a however the bats were able to spread it in China. But just treat your pets just like you would anyone else and just monitor them.
Okay. Here's a question. What are the chances of a person contracting COVID twice?
Very likely.
Oh, couldn't find my mute button. I am one
Very
person that I
likely.
can attest to that myself.
I have seen so many patients come through, and I have that some names just stand out because they are always coming through the laboratory, and it's very likely.
Wow. How does that happen? I mean, I'm just dumbfounded. How does something like that happen? I mean, you get the flu, you don't necessarily get that twice, right?
Yes, you can.
Oh, okay.
You can, just like any other virus, you can be reinfected. Absolutely.
In the same season?
Yes.
Okay, so that's why I'm not a doctor. Okay, so yes, people, you can contract COVID twice.
In
Okay,
addition to that, some people may only be contagious for 3 days after their initial diagnosis. Then I've seen some patients that have their lab tests are coming through the laboratory and they are still positive going up to 2 months. There's no rhyme or reason. There's not enough information for us to say why, but we just know that this person is still positive, and it's been 2 months later, this person is still positive.
so
Hence,
does,
the CDC has come back with those guidelines for when a person is able to return back into the workforce or back into some type of normalcy. But patients can remain positive for a very long time,
does blood type matter? Because we've heard that.
I'll
I
leave
mean,
that one of Dr. Vito. Do you want to take that one?
I would say that it depends. It's more than blood type. There's lots of factors that go into the risk level profile for COVID-19. So there are blood types that have been shown to have, lower or higher risk, but I wouldn't highlight that as something most prevalent. And I'll yield to Dr. McKenzie.
Yeah, that's I was going to say the same thing. I think it's multifactorial, and so and I just want to emphasize that we're still learning so much about COVID. We learn something new about it daily. So I think there's still much to learn and much to decipher in terms of, you know, various risk factors and other items like that. But yeah, I don't, in terms of a specific blood type, I think it's a little bit more complex than that.
Thank you. Thank you so much for that answer. So we've got another question. If 90 days has passed since a person initially tested positive for COVID, however, they have not received a positive test, is it okay for them to get the vaccination? Or instead, should an antibody test be done prior to attempting to get the vaccine? This is a three-part question. So should the 90 days be counted since the initial positive, or do you count once you finally get your negative test? Are you
Well,
stumped?
Well, I'll take the first part of, well, as far as the 90 days prior, after you've been infected with COVID before taking a vaccine, that CDC has changed their guidance on that in particular. Now it's about the onset of your symptoms. Have you been symptomatic in a certain period of time? Now, as far as an antibody test to determine, there are some hospitals and some workforces that prior to administering the vaccine, they will request that you have a antibody or a PCR test to determine if you actually had COVID, really had COVID, because there were some people that never had the test done prior to, they're just going off their symptoms. But there are some that are requesting that a test is done to say that now you're negative prior to giving the vaccine. Again, as Dr. McKenzie stated, there's a lot of information out there. This is fluid. 1 week we're saying this, and then the guidance will come from the CDC where they've lifted this restriction based on XYZ. So this is very fluid. It's constantly changing. We all have to stay abreast on what's going on and just continue to read and research and monitor. But that's the reason for the 90-day window, which has now changed that you don't have to wait 90 days prior to receiving the vaccine.
Thank you for that. And I would like to highlight also that everyone has access to review the data from the clinical trial as it's going, because the study has not stopped. So one of the questions that we often get within our study participants is, well, what are the long-term impacts of the vaccine? So right now we know up until the day that we've been studying the patients, or that they've been studying the patients. So I just want to place that out there as well, to follow the data always.
Okay. I got a question. What if you can't schedule an appointment within the required time for the second dose?
I would yield to your healthcare provider to communicate and discuss a plan of action.
Okay.
Yeah.
Question is, if a person has an allergic reaction to one dose, are you saying that the result is the same as not taking a dose?
No. Do you mind repeating the last part of that question, please?
Are you okay? If you have an allergic reaction to the first dose that you get, is it the same as not actually even having the dose to begin with?
No, I'm not sure that we can say that. I would say that if you are allergic to the first dose, that just means that you may just have something within your system that has allergic reactions to that, and that you should follow up with your healthcare provider. That's what I would say from that statement.
Okay, so I have a few more questions. Let's see. Okay. All right, so we have a person that says that her husband has been struggling with COVID symptoms for the past week. At first, he thought he could handle it, but the symptoms got worse. The coughing got worse, and he felt like blocking out because they own a trucking company and he drives for a living. His temperature is very low. Other people have had COVID, really serious issues. She's been giving him elderberry, vitamin C, zinc, and vitamin D, and lots of fluids. Are there any additional supplements to help him with his speedy recovery? And I think I know the answer to this, but see your healthcare provider.
I'll go ahead and take that one. Just so I'm clear, he tested positive for COVID and he's still having lingering symptoms. I'm not sure if that's what she's asking, but again, the symptoms can linger for a long time. So yes, natural supplements can help to boost the immune system. Again, if he's still having coughing or any type of concerning symptoms, he needs to contact his healthcare provider so he can be monitored more closely. That is a time where I would just tell the patient come into the office so they can be properly assessed. I would tell him also to take the time off work because overexerting himself may be a reason why he's not properly recovering from the virus. So
So he
he
doesn't
needs
need
to follow up with his healthcare provider.
he needs to rest.
Correct.
Correct? Okay. Um, let's see. We have praise for clarifying the difference between a vaccination and an immunization, which amazing that I didn't even know that. That I mean, I use those terms interchangeably. So, thank you so much for clarifying that. All right, here's a question. If a person exceeds the doses schedule, when do they finally take the second dose? When they finally take the second dose, will it be less effective?
I believe I was gonna say I believe there's no evidence on that. I think we need more evidence to collect on that. I have not looked, so that's why I'm starting off with I believe that they did not study what happens beyond that.
Okay.
Yeah, and I would just add, I mean, the studies, it's based on taking getting immunized at the appropriate time. And so just like any other vaccine, you know, it depends, you know, if it's still effective. If you take it outside of the window that's recommended by CDC and ACIP, but we always recommend that you get the vaccine even if you are delayed.
Okay. If you've tested twice positive for COVID, but you're under the age of 65, are you allowed to get the vaccination?
The question I believe is if the person has had COVID twice, or did they just get a test for COVID? So I think there's a differentiation between the two. So if they've had COVID already twice and they're under the age of 65, then they probably would not be within the phase that we're in now to receive priority vaccination scheduling. In addition, the next question I would have for said patient is when did you have the positive COVID last? So for example, were you positive March and April of last year, or was it March and December? Because it matters, because again, going back to those white blood cell defensive players and the memory that they leave.
Okay. Now we have a question from another doctor who's not online, but she's in the chat, Dr. Debrina McKenzie, not related to our Dr. McKenzie. She wants to know if someone could discuss the role of taking baby aspirin every day as a COVID-19 preventative measure. Is that something that's recommended?
So from what I'm aware of, baby aspirin and COVID-19, they looked at it at it was a particular study where they showed that, you know, a baby aspirin a day may help in terms of complications with COVID-19. But I think it's, you know, another one of those preventive therapies that just need more information and need more more data. And I'm assuming it's just due to the, potential thrombotic complications that you can have from COVID-19 infection.
Okay. Do we have any more questions? Okay, so we're gonna wrap this up at this point. Any final thoughts? Dr. Vido?
I was just, how'd you know I had something to say?
Because I just know you. I feel like we're like this right now,
I
and
do
I can read your mind.
No, I was just thinking of how beautiful. First of all, I want to say I was looking at our panel. I was like, man, to have these strong women on this panel alongside me, it really, I feel so blessed to have this opportunity to share the data. And I also feel so happy that evidence is being prioritized. So please, I just want to reiterate, follow the data, speak with your healthcare provider often. Thank you.
Thank you. Dr. Patil, how about you? You got anything to say?
Mainly just protect yourself. The numbers are rising, keeping us very, very busy and overworked. So we cannot stress enough to protect yourself, wear your mask, social distancing, maintain that 6 feet of space. Try not to have gatherings if it's not necessary. If you are having small gatherings, making sure it's less than 10 people. Because the numbers did rise after the holidays. We saw more cases. So just protecting yourself, being responsible, and not exposing those who are most vulnerable. Like I said, our elderly population, those who are immunocompromised, those with chronic conditions.
Thank you. Thank you so much. Dr. McKenzie.
Yes, so I just want to encourage everybody as the pandemic continues on, to just make sure that you, put your mental health first, and that, that you reach out to your healthcare provider if you, are dealing with anxiety, depression. It's common, given some of the self-isolation, given that fear, that anxiety, given the fact that people are losing their jobs. So it's just important to make sure that you make your mental health a priority. And then I also just want to highlight, continuing to, use trusted resources for information about COVID. My trusted resources are the CDC. So you can always go to cdc.gov to learn more about COVID if you have questions about COVID-19. And, just continue to keep up the social distancing, wearing a mask, washing your hands frequently, because that is really going to be key. And take the vaccine once it becomes available to you, because it will be another tool in our toolkit.
Oh, one question. And I know we're wrapping up, but should people be waiting for the Johnson & Johnson vaccination, or should they just get the vaccinations as they come out?
Get the vaccine that's available to you when it's your time.
Okay.
I wouldn't choose between one or another, or wait. When it becomes available, take whatever is available to you.
Okay, thank
I
you.
second that motion wholeheartedly.
Okay, Sandra Powell, what do you have to say?
Well, I echo everything that the previous panelists have said, but in addition to that, just know your body and speak to your healthcare provider as often as you should. And just know that there are tests out there to differentiate between the flu and SARS-CoV-2. So if you feel that your signs or symptoms are exhibiting more of the SARS-CoV-2, don't be silent about it. Speak to your healthcare provider and be your own advocate for your healthcare, because you need to know what you have, know what you're dealing with, because if you know, then you're able to protect yourself and others. So just always speak up and speak out.
Absolutely. Thank you. Thank you so much. On behalf of Alpha Kappa Alpha sorority, Delta Sigma Theta sorority, and now Lambda Theta Alpha sorority, we thank you for tuning in to this edition of what is normally Connect and Elect, but now it's connect with the community. Thank you so much for tuning in. If you've missed anything, if you have any questions, feel free to contact us. You can always find this video online. It will be on, I believe, YouTube, the Delta Sigma Theta Facebook page, our Facebook page, chapters, the Coral Springs, Lambda Theta Alpha. I don't know where yours is going to be, but we'll make it available to everyone. This is such great information. We are just blessed and honored that all of you were able to join us. And thank you so much.